June is Men's Health Month, and this morning, Dr. Joe M. Seiss is here. He's a cardiologist with the Austin Diagnostic Clinic. We're talking heart health this morning. How important is it for men?
Well, it's very important, Erin, and actually, June, we're trying to get awareness for men because it's interesting. A few years back, the CDC released a study, and they found that women were 100% more likely to seek preventable health care than men. And that just means men need to wake up because men are more reluctant to go to the hospital and seek medical attention. So there's simple things that everyone should know about themselves, men and women. Simple things like a height, a weight, blood pressure, a fasting blood sugar, cholesterol panel. These things can help reduce your risk of certain things such as heart disease. And believe it or not, despite medicine and technology and advances, heart disease remains the #1 killer in men and women. Oftentimes this is silent. So 1 out of 2 men who die of a heart disease never even were aware that they had it. So being aware of whether or not you smoke, cutting back on smoking, exercising, dieting, being aware of risk factors, specifically as we get older, that's a risk factor. We can't control that. Having high blood pressure, having high cholesterol, having diabetes, these are all things we can control. These are all things that increase our chance of having heart disease. And so talking with your regular doctor, getting checked once a year, getting certain screening tests will help catch these before they cause a problem down the line. Beyond that, for patients who have any risk factors, such as age over 50, smokers, diabetics, high blood pressure, high cholesterol, it may benefit to get some screening tests to see if there's any heart disease. Such screening tests are offered at various facilities. We have some that are offered at our facility. There are certain things called EKGs, echocardiograms, which are ultrasounds of the heart, scans of the carotid arteries, and scans of the legs to pick up any plaque buildup in the legs. You should really talk with your doctor about what screening test is right for you because they're not right for everyone, and see if you're a candidate or it's something that you should consider.
Interesting. So they're catered to meet someone's specific needs.
Yeah, specifically, you know, if you've got very low risk factors or very high risk factors, you shouldn't be getting these screening tests. If you have low risk factors, they can cause a lot of false readings and lead to unnecessary tests. If you have high risk factors, you should really already be seeing a doctor.
And while I may not be a man, I've been impacted by heart disease. My grandfather died on my dad's side, and my great-grandfather on my dad's side both died of a heart attack. So it's very real, and it impacts many people.
Yeah.
If you need a nagging wife to tell you, hey, honey,
that's usually the case.
Go get it done. If you're watching this morning. And you guys are actually offering a special.
We are offering a special for 4 tests. I think it's $130 for an EKG, an ABI, carotid ultrasound, and echocardiogram. We also offer the calcium score, the coronary calcium score, or the Heart Saver CT scan, which is a quick, easy test that scans your heart and picks up calcium. Gives you a score, and that kind of can pick up and detect early heart disease.
All right, Dr. M. Seiss, thank you so much for joining us this morning. Some very good information that we'll have on our website. So right now,